Hello, welcome to the Harmony Dental Group. I'm Dr. Daniel Faber. Today I'm going to talk about sinus infections and sinus involvement with the teeth. There are many reasons that people come to the dental office with tooth pain. Sometimes there is an actual tooth infection, cavity. Sometimes someone gets traumatized in an accident. Other times there's vague dental pain that they just can't put their finger on which tooth it is. Many times this is related to the sinus. The sinus is an empty cavity in your skull. When you have sinus pain related to your teeth, it's usually on the upper teeth in the back. That's where the roots of the teeth come in very close proximity to the sinus cavity. You can actually see the roots in very close proximity on this x-ray. It may have something to do with enhancing our voices. Some people think it might have to do with keeping our balance, yet there is no exact answer why we have our sinuses. Some even say it may humidify the air that we breathe. Except for a thin layer of mucus, there is nothing in the sinus. It's empty. Except when you have an infection, which may become full of infection material such as pus, or just more mucus, which is more inflammation and congestion, which is not necessarily an infection. This inflammation is generally called sinusitis. You can determine if you have a sinus infection or even sinus involvement by simply changing your posture. Simply leaning over your head and feeling pressure can give an indication that it may be related to the sinus. Also, by pushing on your sinuses around this area very hard, if you feel any pressure in that area, could be another indication that your sinuses may be involved in causing your discomfort. Sinus pain can be quite debilitating. It can lead to not only pain around your sinuses in this area and this area, it can lead to pressure headaches. I especially see sinus involvement and sinus infections during cold and flu seasons and during the changing of the seasons and allergy seasons. It is very common throughout the year, but it's more common during these changes of the season, and I see more of an influx of patients with these conditions during these times. Following diagnosis of the sinus infection or just sinus congestion, I often recommend using what they call a neti pot. Neti pot is an ancient Ayurvedic Indian remedy. It still today is as relevant as it was in ancient times.
Let's get it started in here.
You take the pot, fill it with a salt solution that usually comes with the pot, and some lukewarm water. You lean over a sink usually. It may seem a little eerie and even gross to some, but by using the neti pot, you can pour the water in one nostril and see it come out your other nostril, which indicates that it's actually going through your full nasal system as well as your sinuses. In the case of a sinus infection, I would combine the neti pot with an antibiotic to kind of clear up any residual bacterial infection that maybe remain. Following that, the best thing to do is just controlling your pain with an analgesic such as Motrin or Advil, sometimes Tylenol. I usually recommend Motrin or Advil because it is an anti-inflammatory as well. As you can see, we're able here to combine an ancient holistic remedy with some more modern techniques such as an antibiotic and analgesic or a pain medication. In most cases, by using the neti pot and cleaning out the passages, that's all you need to remedy your situation and go on with your day and move on from the sinus involvement that's causing you discomfort. Although sinus pain related to teeth is a very common dental pain, there are many other examples of dental pain which I will discuss in further videos. Once again, this is Dr. Daniel Faber from the Harmony Dental Group, and I wish you good health. Thank you very much.